Good morning, everybody, and welcome. Welcome to our, I guess it's the end of our first or second week of YouTube Live. I like the venue. Not that I appreciate having you see me on a morning or afternoon, but it gives me an opportunity to get up close and personal with you. This is the same type of venue that we do with a lot of our consultations now. We use Zoom Internet, and it looks just like this, up close and personal, so that I can take a look at you, you can take a look at me, and we can discuss your health. So for those outside of our immediate area here in Peachtree City, those that may feel more comfortable staying home or maybe cannot get out of the house, we have a venue now, very easy to be able to do a consultation time. So if you want more information on that, give a call to our office today, 678-228-8900. Good morning to you, by the way. Thank you to Chick-fil-A for coffee this morning. Little plug for their Thrive Farmers coffee. Keep me in my quote-unquote addiction. I love coffee. And one of these days coming up soon, I'm going to do an entire show on coffee. Not that I need to convince you about the attributes of it, but do you drink coffee? Or do you drink coffee plus cream and sugar and everything else you put in it? But I'm going to talk to you in the near future about coffee in general. But today we're talking about pain, and in particular a pain called neuropathy. In the 23 and a half, almost 24 years of doing radio, doing this kind of a venue, speaking in front of groups, I don't think I've ever addressed this issue. I never realized until a week or so ago how serious a problem this is. When you don't suffer with something, when you don't know what neuropathy is, it sort of gets pushed in the back burner. But in our Bible study, we meet here in this room every Thursday night. There's upwards of 14 of us here that get together to study scripture. We're studying the book of Jeremiah right now. Two of the people out of the 14 are suffering from neuropathy. They're both cancer survivors, and they both have a very difficult time walking. The pain is excruciating. They ended up getting new shoes, new inserts, pain medications, and the list goes on. So we're going to describe neuropathy, which is a destruction of nerve endings that most typically comes from diabetes or blood sugar out of control. But we also see it oftentimes with opioid overuse, as well as on the after effects of chemotherapy. Chronic pain is a big problem in this country, as we all know. This is going to be one of the factors we talk about. It can be incapacitating and expensive. In the United States alone, it's estimated that 126 million Americans report some kind of pain in the last month. That's over 1/3 of our population, 1 out of every 3 people. That includes all our little ones as well. 25.3 million adults report chronic pain, 23.4 million describing intense pain. Chronic pain costs the United States an estimated $560 to $635 billion a year. One situation. And the increasing link between chronic pain and opioid abuse has been described as epidemic. In 2015, there were 33,000 deaths involving unintentional opioid overdose. 2019, that number tripled. Most of these individuals were first exposed to an opioid for the treatment of acute or chronic pain. It started out with a problem. Now, I'm here today to say that the chronic abuse of pain medications or NSAIDs or nonsteroidals can lead to nerve destruction. Yes, it can. As can blood sugar out of control. And with 1 out of 3 people in this country diabetic, with 2 out of 3 teetering on the edge as pre-diabetic, neuropathy is going to become a bigger and bigger issue. I'm sure it's not really a point of discussion, but somebody you know in your family circle, your church group, your friends, is suffering from this. So I'm going to ask you to share this information. I'm going to talk about it. I'm going to give you an actual case study of an 82-year-old man who came in with neuropathy. We're going to tell you what we did to treat him. I'm going to go through all the different various supplements that have been extremely helpful because medicine has nothing for this. Gabapentin has been ed with major side effects of drowsiness and having to go to very high doses to try to handle it. A high proportion of primary care visits involve at least part the management of chronic pain. Low back pain is the leading cause of years lived with disability in the United States. Osteoarthritis, migraine headaches. If there is one idea that we can all agree on based on this information is the treatment of pain in the past is not as effective as we thought. And I still question oftentimes, even though I have friends in this practice, the pain management doctors, which are mostly anesthesiologists, and what they're actually doing to stop pain. Do they ever talk about diet? Do they ever talk about exercise? Do they ever talk about natural cures? Not very often. The complexity of pain needs a multi-dimensional approach, addressing hidden drivers of inflammation, such as stress, a damaged gut. Yes. The more disruptive your gut is, the higher levels of pain. The more weight you carry with obesity, and again, we're approaching in this country 50% of our population being obese. 50% can be another leading to pain or neuropathy. And I'm here today to say that most of these things can be modifiable via nutritional therapy, which can result in decreased systemic inflammation, which is the culprit in many painful chronic conditions. So we're going to talk about neuropathy, which most people see in their hands and feet, primarily in the feet. Excruciating pain that almost inhibits you from walking. And a lot of people with chronic neuropathy can even end up in a wheelchair. By the way, for those of you that might be new, my name is Len Bransowitz. I am I'll call it the voice of reason. I am a registered pharmacist. I am board certified in clinical nutrition and also a naturopathic medical doctor, as well as trained in homeopathy. So we bring the middle of the road concept to most therapies. For those of you that live in the medical world, God bless you, but you need to think outside the box. Those of you that live in the alternative world, God bless you too, but you got to live outside of the box. There's a reason for this great medical system that we have. There's alternative systems that we have, but we must meet in the middle. We just finalized the deals this week on a huge health summit, which will be coming up on April 25th. I know it's February 1, so we're really almost 3 months away, but circle it on your calendar. We're putting together the pieces of an amazing day, which will be here at what used to be called Heritage Christian Church, which is now called One Church. And it's my home church, and I'm looking forward to being and hosting it and being there with you. So let's talk about neuropathy. But before we do that, as we always do, a word from Michael Josephson of Character Counts. Michael Josephson. If you haven't read Character Counts, it's an uplifting column every week that says if we look deep inside of ourselves, if we look well inside of ourselves, we can change our character. And if we all start as an individual, we can spread this throughout the world. My calendar today says, follow me one step at a time. That's all that I require of you. In fact, that is the only way to move through this space-time world. You see huge mountains looming, and you start wondering how you're going to scale those heights. You're living in pain, and I can't get any relief. Meanwhile, because you're not looking where you're going, you stumble on the easy path where I'm leading you now. As I help you get back on your feet, you tell me how worried you are about the cliffs up ahead. But you don't know what will happen today, much less tomorrow. Our path may take an abrupt turn, leading you away from those mountains. There may be an easier way up the mountains that's more visible from this distance. If I do lead you up the cliffs, I will equip you thoroughly for that strenuous climb. I will even give my angels charge over you to preserve you in all your ways. Keep your mind on the present journey you're enjoying my presence. Walk by faith, not by sight, trusting me to open up the way before you. That comes from Psalm 18. Michael Josephson this week. Here's a story about a father and a son who were in constant tension about the son's casual attitude about finding a job. That sounds familiar, doesn't it? The millennials. During a particularly heated argument, the father said, "If you can get a job you enjoy, that's fine, but in the end, a job is the way you make a living." The son answered meanly, "Well, I want something a lot better than wasting away as a manager of a muffler shop." The mother overheard the conversation and was furious. "How dare you demean another man's life? Your dad's a wonderful husband and a father, and people look up to him. He gave up his dream to be a sports writer so he could give you and your sisters a good home and a college education. He may not be your idea of success, but he's mine." And she handed him a poem by Betty Anderson Stanley. "He has achieved success who has lived well, laughed often, and loved much, who has enjoyed the trust of pure women, the respect of intelligent men, and the love of little children, who has filled his niche and accomplished his tasks, who has left the world better than he found it, whether by an improved copy, a perfect poem, or a rescued soul, who has never lacked appreciation of earth's beauty or failed to express it, who has always looked for the best in others and given them the best he had, whose life was an inspiration, whose memory a benediction." And again, that's Michael Josephson from Character Counts. One more time, the number to reach us here in the office today is 678-228-8900. There are many types of neuropathy: peripheral, diabetic, metabolic, that's the pre-diabetic thing, and autonomic. There's actually been nerve damage done. Neuropathy refers to a disease of dysfunction where there's numbness or weakness of nerves. The term peripheral neuropathy, that's our subject matter for today, refers to a disease or injury that causes dysfunction and injury to the peripheral nerves, peripheral on the outskirts. The peripheral nerves describe the peripheral nervous system comprising of 43 pairs of motor and sensory nerves that interconnects the spinal cord and brain to the entire body. It controls your sensations, motor coordination, and movement. In diabetic neuropathy, it's a common complication of diabetes mellitus and can affect as many as 50% of the patients with diabetes. You know anybody who's a diabetic? You need to share this video with them. In diabetic neuropathy, it's a common complication. And regardless of whether it's type 1 or type 2 diabetes, it can severely decrease the quality of life in patients that are affected. While the factors are not fully understood, it's been deemed as a multifactorial process. Some of the factors that are associated with it are poor blood glucose control, increasing age, high blood pressure, high cholesterol, smoking, alcohol consumption, and much more. In the United States, it's been estimated that as many as 47% of diabetics have neuropathy. Autonomic neuropathies affect the autonomic neurons, both sympathetic and parasympathetic. It can be hereditary, it can be acquired. It can be seen in individuals of all races and ages, but happens predominantly in males. Does that help at all? So what are some of the symptoms of neuropathy? Number one, numbness and tingling. Neuropathy means there's been some level of damage. This causes the nerves to become numb, and affected individuals may experience sensations of tingling in various parts of their body. The other symptom, number two, is pain. Some individuals affected with peripheral neuropathy can sometimes experience pain that can be described as sharp and shooting in nature. Most commonly occurs in your legs and can cause a whole world of hurt. The next symptom is called allodynia or hyperalgesia. Allodynia is a medical term that refers to sensitivity to pain that occurs without a painful stimulation. Allodynia can be described as stimuli such as temperature changes, physical stimuli such as walking, and can provoke a burning sensation. It's different from hyperalgesia, which is an exaggerated response to a stimulus that can be painful. Hyperalgesia is the increased sensitivity to the pain that may occur due to damage of receptors, as well as the nerve endings. Symptom number 4, loss of balance. Individuals with peripheral neuropathy often lose their balance due to lack of coordination in several different parts of their body. There are receptors that are subcutaneous tissues that function to respond accordingly to stimuli that occur in the body. Another contributing factor to loss of balance may be muscle weakness, which can lead patients to require help, wheelchairs, walkers, devices, other people. Symptom number 5, issues with your gait. In patients with diabetic neuropathy, these patients experience impaired vibration and protective sensation, a loss of sensation, reduced strength in the lower extremities, and alterations in the central nervous system that can all contribute to issues on how and if they even can walk. It's called your gait. Symptom number 6. This is the one that has often concerned me, cramps. As previously established, there's many types of neuropathy. Patients who suffer from neuropathy often report experiencing muscle cramps. A muscle cramp is an involuntary and rapid contraction of muscle. While it is generally harmless, it can cause severe pain, resulting in temporary loss of muscle function until it resolves. While it is a non-specific symptom that can be associated with many other diseases, it can happen with low calcium levels or low magnesium levels. If you're constantly experiencing muscle cramps, you should have it checked out. Now, again, I do have that quite often. I use a prep called Guna Spasm, which really does help that. Symptom 7, weakness. In neuropathy, when the nerves are affected, the nerves that innervate the muscles also mean the muscles are affected. If sensory nerves are affected, the sensations such as touch, pain, and vibration are affected, and it ends up with a major case of weakness. Next, gastrointestinal problems. Yeah, it can be a contributing factor as well as something that occurs over time. Autonomic neuropathy seen in patients with diabetes is important as it affects a significant population of diabetics, whether they're type 1 or type 2. Some of the gastrointestinal problems affecting those with neuropathy are gastroparesis, or a sluggish emptying of the gut, general signs of dysfunction in the bowel, such as diarrhea, constipation, abdominal pain. All of these can be treated. All of these should be almost the first run of what you're going to do for neuropathy. Symptom number 9, low blood pressure. In some cases of neuropathy where the autonomic nerves are affected, it can cause low blood pressure that leads to dizziness and fainting. Again, keep tabs. If you're feeling that kind of an issue, seek medical care. It's not something you want to live with. Symptom number 10, which is sort of rare, but it's Bell's palsy. You've seen people where a part of their face actually collapses. It's called cranial neuropathy. The cranial nerves originate from the brain or the brainstem in important areas such as the face and the eyes. When the cranial neuropathies occur, one of the conditions that can result is Bell's palsy. You also see Bell's palsy as a complication even with something like Lyme's. So there are some of the conditions. Now, I want to give you a case study. But again, I want to take a break, have a little sip of coffee. The purpose of this show today was not to convince you that you may have neuropathy, but that if you do know somebody with neuropathy, I'm going to give you some solutions. Here's a case study. An 82-year-old male, severe pain in both anterior lateral thighs, lateral shoulders, rated 7 out of 10. On the pain scale, he reported the pain is constant and only mild relief is found with over-the-counter non-steroidal anti-inflammatory drugs, and the doctor put him on gabapentin. That's the one I had told you about. It comes with a lot of drowsiness side effects. The patient is severely limited in most of his very basic activities and is unable to walk without a cane or a walker. Even with assistance, he must stop every 20 yards to catch his breath and regain his balance. Remember that, his balance. His balance issues are combated by severe peripheral neuropathy in his legs, for which he was diagnosed by his primary care physician about 6 years ago. He reports intense brain fog and forgetfulness. Now, that can come from that autonomic issue as well as the gabapentin. And more than likely, it is the gabapentin. He can drive a car but avoids doing so because it makes him very nervous. The patient has multiple comorbidities and was diagnosed with high cholesterol 25 years ago and put on a statin medication, which should never, in my opinion, be done with somebody in their 80s. About a decade later, he was diagnosed with type 2 diabetes. Put on metformin and has since added an insulin drug as well. Although he followed medication directions, his diabetes progressed. His hemoglobin A1C rose to above 9. He's put on 50 units of insulin per day. His pain, which began mildly as an ache in the legs about 15 years ago, grew into exorable pain in his legs and shoulders over the next 6 years. He was prescribed NSAIDs and gabapentin, which did provide some mild relief. He also noted his dizziness and loss of balance became more severe and his condition progressed. Medicine gave it its best shot. So the patient was given a treatment plan. A little bit of exercise and rehab through a physical therapy department, maybe some underwater physical therapy. Got a walking and biking plan that he was going to integrate over the next 3 months. But again, as he said, I can't walk, my feet are burning. They said, we're going to work on that. He was prescribed a form of the paleo diet or even the keto diet, two which would fit in very well. Now, as a diabetic, we'll go with the paleo and really talk to him intensely about his diet so we can help control his blood sugar as well. He agreed to strictly follow that for 3 months. He would contact a health coach every week for accountability. Finally, the patient was prescribed a broad-spectrum nutraceutical regimen that targeted the causes of the metabolic dysfunction, inflammation, and filled his drug-induced nutrient depletions. So here's what he was given. Quercetin, about 240 milligrams a day, modulates dopamine, prevents mast cell degranulation, a whole lot of different things. Quercetin, that grape seed extract, which is amazing, is a good starting point. Resveratrol, 10 milligrams a day for 60 days. Again, the right forms, that is just amazing. Bromelain, a natural anti-inflammatory, sometimes seen as a digestive enzyme. It inhibits inflammation by modulating leukocyte activation. Also gave him N-acetylcysteine, which produces glutathione, which again, we gave him 900 milligrams twice a day during that time. Alpha lipoic acid we used, and that seems like a lot, but we needed to control his blood sugars as well. Alpha lipoic, in the right forms, can help control some of the blood sugar issues. Acetyl-L-carnitine, 500 milligrams a day for 60 days. Increases medium-chain fatty acid, oxidation, and mitochondrial energy production. 2 more things. Methylated folate, between 1,500 mics and 5,000 micrograms a day. We're finding that most individuals in this group can classify with that MTHFR gene defect. And lastly, probably the most important, vitamin B12, methylcobalamin form. High dose, 500 micrograms a day or more over the next 60 days. The results were improved metabolic labs, a decreased hemoglobin A1C, a decreased LDL cholesterol, a decreased fasting blood sugar, and a weight loss of over 30 pounds. Patient was able to lower his statin medication and discontinue his insulin. The factors leading to diabetic neuropathy are not completely elucidated, and although multiple hypotheses have been explored, there's still a lot of unknowns. We do not know that the development of neuropathy is a multifactorial process that depends on impaired glucose tolerance. In this case, the two-phase plan was developed that would first address the most immediate cause of the patient's pain via neuropathic damage, and secondly, address the oxidative stress and inflammation. We worked on the mitochondria, we worked on healing the gut lining eventually, and over the next 12 months, we saw this fellow start to be able to walk again. Now, that's a start. Now I'm going to share just a couple studies, and then I'm going to talk to you about this. A new prep called NEUROPATH-EASE. Specific. Now you tell me where there's been a product specifically attuned for helping with neuropathy. Study number one from the Journal of Nutritional Medicine, Diabetic Polyneuropathy, Integrating a Vegetarian Diet. Now this has to be done under the auspices of somebody that knows how to regulate a diet, a dietitian, clinical nutritionist. Because in most cases, if it is a diabetic, we have to make sure that we can monitor his blood sugar as well. Next, polyneuropathy and folate deficiencies. The Archives of Neurology. 5 cases of polyneuropathy respond to 10 to 15 milligrams of folate. Neurology, Crohn's disease, polyneuropathy. The intra-connection between gut health and neuropathy. Next, from the Department of Neurology, Beth Israel Deaconess Medical Center. In a retrospective cohort study of 581 patients with polyneuropathy, supplementation with vitamin B12 was found to bring around significant subjective improvement in symptoms. Again, it's methylated cobalamin. Intramuscular or oral supplementation with acetyl L-carnitine may improve pain in polyneuropathy. Double-blind, parallel group, placebo-controlled, multi-center study that was done in the Royal Free Hospital in London showed acetyl L-carnitine, dosed aggressively enough, helped with most of the symptoms. Botox, again, going back to the pharmaceutical side, and ginkgo may relieve diabetic nerve pain. Injections of botulinum toxin relieve pain in animal models of diabetic neuropathy. And again, the study was done by Dr. Lakovic from Zagreb University in Croatia. Second presentation was a combination of ginkgo biloba and folate that reduced the symptoms of diabetic neuropathy. Dr. Suzanne Koppen from the University of Essen in Germany and colleagues randomly assigned 60 diabetic patients with neuropathy to a standardized ginkgo biloba extract, folate, both agents, or placebo. We found that all 3 active treatments were superior to placebo, with the best effect seen in the combination of folate and ginkgo. Large study, National Clinical Practices in Nephrology. It says the benefits of acetylcysteine for the prevention of contrast-induced neuropathy after a primary angioplasty. Here is a drug-induced case of neuropathy by using the contrast dye that was used in these studies. Yeah, it happens because your body isn't capable of excreting it off. And in this case, they used intravenous acetylcysteine, sometimes called mucomist. It's available as N-acetylcysteine to make a big change there. Acetyl L-carnitine may treat neuropathy in cancer patients. Systematic and neurophysiological responses to cisplatin-induced neuropathy using oral acetyl L-carnitine. European Journal of Cancer. Peripheral neuropathy, acetyl L-carnitine. And this is one, for those of you that know somebody that has a compounding pharmacy, and if you don't, I can put you in touch. Temporary relief of neuropathic pain using topical geranium oil. You know the flowered geraniums? Postherpetic neuralgia has a feature of all neuropathic pain syndromes: sensory abnormalities, ongoing pain, well-defined pathogenesis, well-defined onset. Purpose of this trial was to verify the observations of neuropathic pain relief with topical geranium oil, to confirm its safety, and define a dose-response relationship. The study was multi-center, double-blind, crossover design using 5 groups. Bottom line is, the intensity of pain that was found using this, it says 24 of the 30 subjects completed the studies. The geranium oil treatment produced a significant reduction in pain spontaneously compared to placebo. Pain reduction was dose dependent. Post-herpetic neuralgia pain can be severe, disabling, and treatments are less than ideal. Topical capsaicin relieves pain gradually over 2 weeks. Geranium oil reduced pains in minutes and was well tolerated. I have an entire file on neuropathy. If you want to stop into the office, we're located at 1200 Highway 74 South, Peachtree City, Georgia. Stop in. We'll talk about it. Now, from my friends at Nutritional Frontiers comes an all-in-one prep called NEUROPATH-EASE. 2 capsules daily with food, or as directed, we can actually go higher. And again, a lot of what we talked about in neuropathy consists of numbness, tingling, sometimes weakness caused by damage to peripheral nerves. So in order to treat this, we wanted something more targeted and more direct. So we put together this alpha lipoic acid, as we talked about in that case study, an important antioxidant nutrient can provide protection against developing peripheral neuropathy. Second, which I haven't seen before, but we integrated in here biotin, the B vitamin that plays a central role in the body's ability to process glucose. It can be used to reduce pain from nerve damage caused by diabetes. Next, B12 in the form of methylcobalamin, a superior form with enhanced absorption. Folate. Again, we put the 5-methylfolate form in here right with each capsule. Chromium. The mineral that's included was used to prevent neuropathy in diabetics. And again, it is the chromium nicotinate glycinate chelate. Lastly, Boswellia serrata is found throughout Western and Central India. It's used as an Ayurvedic medicine to target inflammatory conditions. Research supports its use as an anti-inflammatory that can help to reduce pain. So again, as this says, supports neuropathy conditions, healthy nerves, B12 levels, folate levels, inflammatory conditions. You want more information on that, you can look it up online. It's called NEUROPATH-EASE. Or call our staff. They'd be glad to fill you in on that prep. On Monday, we're going to talk about habitual tea drinkers. You know, maybe you. We're going to find out that habitual tea drinkers actually have better brain function than most of us. Again, the numbers to reach us, if you heard something you like, check out our past shows. We have a whole lot of those. You can get those right from the blue little section on our website at thenutritionshop.net. It'll bring you right into our whole sections of past shows. We just started this a little over a week ago, so there's about 8 of them in there. Check it out. Share them with others. And if you have questions, you develop questions, please give us a call at 678-228-8900. 678-228-8900. God bless you, folks, and I'll see you back here Monday. Have a great, healthy weekend.